Hello, I'm Michael Hogue, President of the American Pharmacists Association. Welcome to our weekly webinar addressing the COVID-19 crisis, our open forum series for pharmacists. We thank all of you for joining us today. I am your host and moderator for today's program. Today's focus is on Board of Pharmacy changes and the impact that pharmacists and pharmacy practices are experiencing during the pandemic. In order to cover this topic, as we've let you know in advance, we are pleased to be joined today by Dr. Carmen Catazon, the Executive Director of the National Association of Boards of Pharmacy, or NABP. Carmen is not only the executive director, but he's also a pharmacist and understands the issues that our profession is facing as a pharmacist. And so we're really pleased to have Carmen joining us today. And as we have in the last couple of weeks, we're pleased to have two APhA staffers who will be helping us out with Q&A today. Elisa Bernstein, who is Senior Vice President of Pharmacy Practice and Government Affairs at APhA, who has had a long career also prior to APhA with the FDA, and Dan Zlot, who is currently Vice President of Professional Education Resources. Dan has a 10-year history at NIH as an oncology and infectious disease specialist, and so he'll be sharing his insights during the Q&A session that we have today. Now, I want to just quickly go over our agenda. First of all, I'll point out that on the right-hand side of your screen, on the GoToWebinar control panel, you will see down toward the bottom a tab that says Handouts. And the slide set in PDF format for today's program is found in that Handouts section. And so we'd encourage you to take that and print it and use it as you need. Second thing I want to tell you today is that if you've joined our webinar today via telephone, please be sure that you type in the audio pin now while you can. The audio pin, you should already have it. It's over on the right. But type that in, because during the Q&A session, when it's your turn to speak and we call on you, that audio pin has to have been put into the phone in order for your line to be active, in order for us to unmute you and allow you to speak. Now, if you're using your computer's speakers for audio and you're called on to speak, be sure that your computer's microphone is unmuted. For now, we have everybody muted on our end, but once we unmute you and call on you, you'll also need to make sure that your phone or that your computer is unmuted so that we can hear you. Now, as a follow-up to last week's webinar, I also want to let you know, you'll remember that we were joined by a person who's with the CDC, and we announced at last week's webinar, breaking news, that the CDC has released a document that outlines precautions that pharmacists and pharmacy personnel should take as it relates to the COVID crisis. And we had quite a discussion about that last week. We want to let you know that that's now live and posted on the CDC's website. You can search for it there, or you can go to pharmacists.com and search the COVID resources, and we have a link to it on pharmacists.com as well. So with that, I want to remind you that over on the right, you'll see a question box. If you have questions that you'd like to pose to myself or to any of our speakers today, we're going to ask that you first type those questions into the question box. We'll process those questions, and then at the appropriate time during the webinar, we'll call on you to actually speak and ask those questions out loud. But we ask that you put them in the question box first so that we can get a sense for what the questions are and keep the webinar flowing. This is intended to be an interactive webinar, not a lecture, so we want to hear from you. We don't only just want questions, by the way. We're looking for your feedback and your input as to what's happening on the front lines in pharmacy. So please be sure that you share with us your experiences and things that you think APhA and the profession need to hear about what's going on in practice. So with that, I'd like to start us out with an interview with Carmen Catazon, talking about boards of pharmacy. So Carmen, thank you for joining us today.
Thank you, Michael, for the opportunity. My thanks to APhA as well for the ability to interact with your members.
Well, Carmen, let's just get right into the meat of this thing. Can you tell us how boards of pharmacy are approaching the emergency health and human services and executive orders that are expanding scope of practice and other state regulatory provisions?
Michael, normally when you mention boards of pharmacy, I think the initial reaction is one of disciplinary and being prohibitive. I'm pleased to say that the boards of pharmacy are responding positively to those executive orders, both at the federal and at the state level. And we've seen a cooperative spirit within the boards of pharmacy to allow for exemptions, allow for exceptions, and expand the scope of practice for pharmacists and technicians within their authority, which is really a whole different route that the boards have been able to take based prior pharmacy practice and regulatory issues.
Can you tell us, Carmen, some of the general areas where many states maybe have made some changes?
Sure. I guess a couple of main areas. One is the ability of pharmacists and technicians to actually practice remotely. Boards of pharmacy are relaxing those requirements that would require those people to be in the pharmacy or actually be in state, and allowing for remote workload or remote work sharing. Second, they're also allowing pharmacists, technicians, and even pharmacies that may not be licensed or registered in their state, but hold a valid license or registration outside of their state with another state to actually practice within their state, to send medications to patients that need them, provide pharmacist care, and to balance again the workload that may be occurring with the pharmacy within the state. And finally, they're looking to expand what the pharmacist can actually do and being a vital part and on the front line of this pandemic crisis in terms of therapeutic interchange, in terms of consultation, in terms of some of the testing that pharmacists are being allowed to do during this pandemic.
Let's go back real quickly to that issue of licensure. Carmen, you mentioned that some states are allowing pharmacists to practice across the across state lines. Is that every state that's doing that, or can you give us a gauge of how many states roughly are allowing pharmacists to practice across state lines?
Sure, Michael. And generally, it's not good to generalize across the states, but I think with what's happening with the pandemic, that's again something different. I could say with confidence that virtually every state is allowing some sort of exception for licensure across state lines. Now, it may not be for pharmacists, it may not be for pharmacies, it may not be for technicians, but every state is allowing for some exception and working with pharmacies, pharmacists, and technicians to allow that. So the easy answer to the question is all the states are allowing, in some regard, pharmacists to be able to practice across state lines. It varies what that exception is state by state. And so we would advise you to check either our website for a document that lists all those exceptions and what the states are allowing, or to go to your individual state board of pharmacy's website. But overall, if you're a pharmacist and you want to volunteer, or you're trying to practice in another state to be a part or assist with the pandemic, it's a pretty clear road. But again, check with the state board of pharmacy website to make sure that there are some other requirements you need to fulfill.
All right, well, that's great information. Now, we are seeing product shortages of various kinds happening across the country with various types of products. How are the boards of pharmacy addressing pharmacists' ability to perform therapeutic interchange when patients' medications are not available?
And looking again at what the states are doing, we surveyed the states last week, and we found that less than 20 states have prohibited therapeutic interchange, and some of those prohibitions require that they be part of a collaborative practice agreement. Among those 20 states that said it was specifically prohibited, 5 of those states are actually considering removing that, discussions with the governor's office or discussion with whatever the authority within that state is that has placed that prohibition on the board. So the remainder of states, in replying to the survey or not replying, gives us the impression that therapeutic interchange is not something that may be specifically addressed, so it's not prohibited, or that state has already cleared the way for pharmacists to engage in therapeutic interchange. Again, 2 caveats. 1, check your state's website to make sure that's allowable in your state. And if the majority of states have responded positively or haven't responded, it's probably a good case that your state will allow it. And then 2, the DEA advised us just last week as well that the only therapeutic interchange they'll allow, according to DEA for controlled substances, is to substitute a strength rather than to actually therapeutic interchange. So amongst controlled substances, the DEA has said that there is no therapeutic interchange except to substitute a strength when you may be out of a particular strength.
That is a really important clarification, so thank you for bringing that to all of our attention. Now, I will tell you, having monitored APHA's discussion boards and looked at questions that we receive weekly here on this program, safety and lack of personal protective equipment are top concerns that are expressed by pharmacists across the nation. How are state boards of pharmacy addressing concerns for patient and provider safety at this time?
Yeah, that's probably one of the more difficult issues, Michael, that the boards are facing. And my thanks, my prayers, my thoughts for all you pharmacists and techs who are on the front lines having to deal with this issue. And I wish there was a simple solution, or I wish there was more PPE available. What the states have tried to do is, again, relax and also to work with USP to see how much latitude there is on the use of PPE within the standards, so that if pharmacists have to reuse equipment, or if the pharmacist can make a judgment based upon risk, that it's safe to do so, that judgment rests with the pharmacists, and the state boards are trying to reinforce that and support the pharmacists from doing that. In cases where the pharmacist may be asked to do things that are not safe, that could endanger the staff or even patients to contamination or exposure, the state boards have taken action and said this activity will not be prohibited, will not be allowed, and they will hold the pharmacy manager responsible if that does occur.
So, Carmen, it sounds like, if I'm understanding you correctly, that that you really do support the autonomy of the pharmacist to be able to make professional decisions as it relates to safety and security of themselves and their staff.
Wholeheartedly, and my supporting that means little, but NABP and the states support that entirely.
Okay, great. Well, thank you for that. That does help us with some reassurance, and we appreciate that. How can pharmacists utilize telehealth, and what is it the boards of pharmacy are doing there? You kind of alluded to this in your opening statement, but you know, telehealth is emerging as really the most important development, and a rapid advancement of telehealth is happening across the healthcare system. Tell us about laws and regulations and boards of pharmacy's views on telehealth given the crisis.
Yes, Michael, and it goes back to your first question about what boards of pharmacy are allowing and how they're interacting and reacting to all those executive orders. For most of us, except for those pharmacists that really are involved in telehealth and telepharmacy, telepharmacy was primarily a service for rural areas or patients that didn't have access. It was just beginning to take root as a more common practice, and now with the pandemic and all the executive orders allowing for telehealth, it has really descended upon pharmacy practice in a significant way. And what boards are saying or looking at, or the direction they're giving to pharmacists, is you still have that responsibility to ensure that it's a valid prescription, a valid prescriber-patient interaction. And if you have that validity and you can document and justify that, boards are willing to work with the pharmacies through telehealth, through some of the video conferencing that's occurring during the pandemic, to make sure that patient gets served, that patient has access. Again, the pharmacist has to use their judgment and check with their state to make sure there's not something that they want to do that's strictly prohibited. But again, the boards have said we need to be a part and a solution to this pandemic, and we're going to work with pharmacists to provide the care and give the access to patients that they need.
Okay. Well, I want to move on to a different subject. I want to talk about emerging therapies. We've seen in recent days that some states are restricting medications when the FDA has issued guidance. And so, for example, FDA issued guidance on hydroxychloroquine, but then some states may only allow dispensing for approved indications or in limited quantities, and so forth and so on. You know, are considerations being made for the needs of patients who are taking these for approved indications, and how are boards of pharmacy addressing this issue?
Yeah, the shortages that have been caused and the stress placed upon patients that take these medications on a regular basis is the reason the boards have reacted and limited or put in additional restrictions for the dispensing of these products. The boards were first to notice that there was a hoarding situation occurring where some prescribers and some hospital pharmacies were actually stockpiling these medications and writing medications for themselves and their families as a prophylactic means, or in case that the medications proved to be the best way to treat the virus. What the states did to protect those patients and ensure that there would be an ample supply is limit the dispensing of those products to legitimate prescriptions, and they've set criteria how to define that legitimacy, and then they've denied refills and asked the patient to get a new prescription just to ensure that they're dealing with a documented and valid case, and that we stop the hoarding that could cause some significant damage for patients that rely on these medications on a regular basis.
Okay, all right, that's great. I want to ask two more questions before we start taking questions from our audience. One question that we've heard from many of our student pharmacists who are graduating, we're hearing concerns that testing centers may not be open for graduating students to take the NAPLEX or the MPJE exams. Can you tell us the status of testing center availability? So we're curious to know where that stands.
Yes, and again, we realized during the pandemic that so many things that we're used to have been thrown into other chaos, and I think everyone's working to try and bring some normalcy to that chaos. Because of the efforts of the test vendor we use and a recognition of pharmacists as frontline first responders, there's a tier of testing that's occurring now and running through the end of April for only first line responders, such as medical personnel, nurses, and pharmacists. As a pharmacist, that was a huge recognition by the testing site centers and by people around the country to include pharmacists in that first responder tier of testing. So there are approximately 150 testing sites that are open across the country. Pharmacists whose appointments were canceled have the opportunity to register at those sites, and it's going to be maybe a longer drive than normal, or maybe a different time than you selected. But we are very fortunate to be in this first tier of testing for frontline responders and first responders. After April, the plan is to open all of the Pearson testing centers across the country, but with limited seating capacity in order to be in compliance with state physical separation guidelines and also with some of the curfews that states have put in place. Again, pharmacy is included in that next tier. And again, there'll be seats available, not as many as we'd like, not as easily accessible as we'd like, but we are hoping that as the pandemic subsides, more and more of those opportunities will open up so that graduates won't be delayed too much longer, and they'll be able to earn their license and actually get out and practice as pharmacists.
Okay, well, that's good information, and I'm sure, again, very reassuring to graduates who are coming out here in the next few weeks. Carmen, if you had a crystal ball, and I heard that you might, how do we change pharmacy practice to better prepare ourselves for these types of emergency situations in the future? What needs to change with pharmacy practice?
Yeah, I do have a crystal ball, Michael. I've used it to try and predict on the sports teams and the winners, but I've lost a lot of money, so I'm looking for a new crystal ball.
Well, maybe you can predict the Cardinals will win the pennant whenever baseball starts back.
I'll ask that question. I guess what the pandemic has made us look at is a couple of things. One, the flexibility for state boards of pharmacy to be able to act and allow pharmacists to engage in the activities that pharmacists were educated and are the experts at and can do that would make a difference. Two, what are the real backup supplies, backup processes that we need to have in place that we can actually sustain? We can't put in some backup systems or processes for a few weeks after the pandemic and then 6 months later or a year later not refresh that or not sustain those. And then third, practice is going to change significantly. And we have to realize that's going to happen. How do we structure and prepare boards of pharmacy for those changes so that the boards can continue to be supportive and move along with the profession, but making sure the primary concern is that the patient's protected? Okay.
Well, that's I think we all sense that healthcare provision in this country will never be the same after this pandemic. And certainly, I think we've all seen that the role of the pharmacist has been highlighted as critical to our nation. And I think that there's no question there's going to be changes. Now, I want to open it up for our audience to be able to ask questions. But before we do, I have two quick polling questions I'd like to ask the audience. So if the staff will please bring up our first polling question, it'll pop up on your screen, and then you'll have a response box. The first question is, I feel my State Board of Pharmacy is doing everything possible to optimize my ability to take care of patients during this pandemic. There it is. Poll is in progress. Okay, let's show the results. Looks like 61% of you said that yes, your State Board of Pharmacy is doing everything possible. 21% of you said no, and 19% of you said this is not applicable question. All right, one other question just to get your thoughts. Tell us about the level of communication. The level of communication from my Board of Pharmacy during this pandemic is too much, just right, or too little. This is the Three Bears story, right? Too much, just right, or too little? All right, level of communication. We're getting our responses up here. All right, let's close the poll and get the results. Well, it looks like we need a little bit more communication, Carmen, from our boards of pharmacy. The majority of pharmacists responding today feel like there's not quite enough communication coming from the boards. So maybe that's good feedback that NABP can take back to the boards today.
Yep, that's great feedback, Michael.
Yeah, so we're going to now open our forum, do our open forum, and I'll just share the ground rules again. Use the questions box that's on the right-hand side to submit your questions. And in fact, we've already received a pretty good number of questions. Individuals whose submissions are selected, I will call your name, the staff will unmute your line, and then to maximize the amount of time we have, you'll have up to 60 seconds to be able to state your question verbally so that Dr. Catazone can speak to your question. We'll try to take as many questions as we can before we move on to the next segment of our program. So let's start this open forum discussion. I'm going to call on the first question we're going to ask is going to come from Starlin Hayden Gretting, and I'm going to ask Starlin she has a comment and a question. So if Starlin would ask her question, please.
One of her lines is on. Go.
Thank you for doing this, because we've, at the Pharmacy Association level, we've gotten a lot of questions about that. First of all, fire up for pharmacy. Second of all, on your PPE question, where the pharmacy boards are holding the pharmacy manager in, is that going to go all the way up to the C-suite so that the people that are managed by a larger organization, there's some meat in that for those people? Because we're getting that question. And secondly, last year, I just want to let everybody know that your telehealth ability beyond telepharmacy may be coming from your public health department issuing and adding pharmacy and pharmacists having the ability to provide telehealth services. And we had a telehealth act, and that's outside of the Board of Pharmacy. So stay in touch with your state pharmacy associations as well. Thank you, and thank you, Carmen.
All right, Carmen, would you like to reply to that?
Sure. Hi, Starlin. Yes, what the process will be for the state boards is they'll work with the pharmacy manager first. If the pharmacy manager comes back and says it's out of my control, it's the corporate decision, or it's the pharmacy district manager, then the boards will act on the permit for that pharmacy. And the last thing a C-suite wants to see is for a pharmacy to be closed, and that usually gets people's attention. So the boards will go up the chain of command and find responsibility and act on it. It may take a while because of due process, but it will happen. And second, the point you made, very important. What the pandemic is also showing us is that these executive orders at the state and federal level are impacting boards of pharmacy and putting authority in other departments or adding authority to other departments. And so boards of pharmacy and state associations have to work very closely to make sure that that authority is with the Board of Pharmacy and appropriately administered.
Great, great. Let's take a question from Kyle Heimer. Kyle, let's unmute your line. Kyle Heimer. Okay, he's not able to speak, so I'll ask his question for him. Kyle has asked the question, can HIPAA be suspended or amended for Good Samaritan efforts in terms of medication delivery? Apparently we're doing lots of medication delivery now. Obviously we are. What's your comments about HIPAA and anything the feds have said about that, Carmen?
Yeah, Michael and Kyle, the problem here is when authority is outside of the Board of Pharmacy and with another federal agency, it's difficult for the Board of Pharmacy to opine or to give some direction. But again, overall, if you're doing what's good for the patient and you have to in some way violate HIPAA to make sure that patient is accessed or information is conveyed, that's going to be your professional judgment and decision. And I don't think anybody is going to not recognize that that's what the pharmacists have to do, but you have to be very cautious and very judicious when you make those decisions.
All right. Let's open the line for Phil Schneider. Mitch, is Phil's line open?
Says
Okay,
it's open
there
now.
we go. I gotcha. Took me a while to navigate that. Nice job, Carmen. Good to hear from you again. I'm interested in the long-term impact of the short-term crisis on pharmacy practice acts and the profession of pharmacy, preferably in a positive way, but maybe possibly even a negative way. So a crisis is a terrible thing to waste. Do you see long-term changes resulting from the situation we're in now?
Yep, good to hear from you as well, Phil. I hope you and your family are safe. I think you've encapsulated it well. The boards of pharmacy are going to take a look at this and say, we've allowed some exemptions and exceptions. How do those impact the patient? And if there was a positive outcome, I think you're going to see the boards of pharmacy in revising their practice acts say, let's keep this in play. This looks like something that really worked and something we could manage. On the other side of the equation, if things didn't work so well, or if other agencies have encroached upon that authority of the boards of pharmacy, then you may see practice acts change significantly and some of that authority move out from the Board of Pharmacy to other agencies. And we don't think that would be a good move. So good and bad, pretty much along the lines that you've suggested, Phil.
All right, let's take a question here from Richard Dang. Richard, we'll unmute your line so you can speak.
Okay, line open.
Hi, thank you, President Hogue. So I'm curious as to what kinds of actions, either supportive or punitive, various state boards of pharmacy will be taking against pharmacies who don't have appropriate access to PPE, especially in areas where they're now required by local or state laws or regulations. So we've had some independent pharmacies express concerns that they're not able to procure gloves or masks for their employees, and they're legally required to now.
Yeah, Richard, within the pandemic, again, there's going to be a lot of common sense and a lot of what is the ability of somebody to do. So if we have a situation like in all the states and many pharmacies, if that equipment is simply not available, the pharmacy and pharmacists have to make a decision as to what is in the best interest of the patient's safety and their staff safety. And the decisions are either to try and minimize the risk when you're already putting yourself at great risk, or close the pharmacy. And if you close the pharmacy and patients are denied access to the medication, that has a very significant impact as well. So the boards will look at all those factors and say, did the pharmacy do what they could do under the situation? And if they couldn't, maybe then they would look at disciplinary action if they were being reckless or careless or forcing their employees to do things that they weren't comfortable doing. But on the other side of it, if the pharmacy made a choice to continue serving their patients and not close the pharmacy, I think the pharmacy board is going to look at that and be hard pressed to discipline a pharmacy that's trying to do the right thing.
Great. All right. That's a good question. Let's take the last question for this segment. We're going to continue to take questions. I just want to get this this one here before we open it up to some broader questioning. Robert Kamjathi, could you please ask your question? Robert Kamjathi. All right, maybe there's no mic. Okay, I got that. All right, so let me ask the question. Are the Army Corps of Engineers makeshift hospitals such as the TCF Center in Detroit going to be treated as federal facilities? Are they going to fall under state boards of pharmacy? Just wondering about the reaction time to get a hospital pharmacy up and running legally.
Unfortunately, or fortunately, depending upon where you're coming from, all of those makeshift and emergency and temporary hospitals by the Army Corps or that the federal government is putting in place will be outside of the rules and regulation of the boards of pharmacy. We've seen in states where that's happening that some of that is good and some of it's not so good, but there's not much the states can do.
I did notice, Carmen, and you might want to comment on this, the Alabama Board of Pharmacy, for example, just adopted new rules on establishing remote pharmacies and a rapid system of getting Board of Pharmacy approval for that. I would assume several boards of pharmacy have probably done something similar.
Yep, that's part of the positive response. They're allowing for those temporary and remote locations and expediting the process. And the DEA has also said that they're going to work with states to allow for temporary locations and expedite that process. And that's a big change from the DEA and from the states.
Yeah, great. Okay. Well, there are a lot of questions that have been submitted in the question box about the issue of COVID testing. And so on the next slide, I'm going to ask Elisa Bernstein. I think she's on the line with us now. She's been having some tech difficulty. Elisa, could you speak to us about some late breaking news that came out just yesterday about pharmacists' authority to order and administer COVID-19 tests?
Thanks, Michael. I'm happy to, because this is very exciting news, and I apologize. My phone has been going off all day if I drop in the middle. But yesterday, the Office of the Assistant Secretary for Health issued guidance authorizing licensed pharmacists to order and administer COVID-19 tests, including serology tests that FDA has authorized under an emergency use authorization. And so it was a one-pager. That's what's on the screen here. The guidance also notes that it provides pharmacists immunity from being sued for administration and use of FDA authorized use tests. And that is as long as they're used as under the directions for use. So we're still evaluating the scope and the impact of the notice and how pharmacists can get paid for testing, including under Medicare and Medicaid and private plans. You know, this also raises logistical issues. And of course, as we've talked about here again and again, pharmacists need to have access to appropriate PPE to administer these tests. I can assure you that APhA is on top of this and seeking clarification and any additional actions that are needed. We're working with our sister pharmacy organizations, reaching out to CMS, FDA, states, the National Governors Association, Congress, the private sector, and more to get answers and a pathway for immediate implementation for pharmacies across the country. APhA has resources and information available for you to help you understand the different types of tests that are available, how to determine if an EUA has been issued for a particular test, as well as red flags and tips on how to identify fraudulent tests and scams, which many of you on the phone I know have received offers for. These resources and information are available at FDA's website within the Pharmacist Guide to Coronavirus under the Information for Pharmacists. It's actually information pharmacists need to know now. So the guidance, you know, this is fantastic news, and it shows that the administration recognizes the value that pharmacists can provide as essential providers on the front line. We all know that we're trained, experienced, and accessible, and it's wonderful to know that those coordinating our national response recognize this as well. And so there will be definitely more to come on this, but this is fantastic news.
All right. Thank you, Elisa, for that. Now, to kind of lead off on some questioning related to COVID-19 testing, we have a question from Rear Admiral Ty Bingham of the U.S. Public Health Service. Could we please unmute Rear Admiral Bingham's line so that he can ask his question that's directed to Carmen Catazone?
Line is open. Hear me?
Go ahead.
Can you hear me?
Yes, we can hear you. Thank you.
Oh, very good. I just had to switch to telephone mode
because I couldn't get my speaker to work, or my microphone to work. So anyway, I knew this was coming out. We've been working on the wording for that, and we're excited. And I was just wondering, what everybody is doing to get pharmacists excited about this and move forward. What an opportunity for us to step into the limelight, make a difference. Like you said earlier, don't let any pandemic pass us by, so to speak. And so I just encourage everybody to get involved with this. I know the payment is still being worked out. OMB is always a monster to pass. And I think CMS has the lead on this now. And I know everybody, like you said, is working with them to help figure out how to incorporate reimbursement. But with that being said, we have the first win. And I think that's really important.
Yeah, thank you so much for that. Carmen, I wonder if you could just comment on what the state boards are doing to help facilitate pharmacists being able to do this COVID testing. Is there additional regulation necessary at the state level, or is this broad authorization from HHS enough?
Hello, Ty, and thank you for that sentiment about pharmacy taking advantage and getting involved in this. Michael, the states are looking at that order now. Questions about whether or not this is one of those emergency authorized tests that the FDA has sort of bypassed the approval process, and whether or not states have the authority or don't prohibit the authority. But overall, again, I think the states are just as excited as Ty and others about this. And I know that when they can and where they can, the states are going to empower pharmacists and try and promote this as much as possible.
And can you speak anything at all about CLIA waivers? I mean, there's been lots of questions about whether these tests require CLIA waivers. They are or they aren't, and what do pharmacists need to worry about relative to CLIA?
Yeah, I think that's an important question, and it's still too early for us to determine. I would refer them back to APhA and your COVID pages. You all find more information. We're looking at the issue as well, but I don't think anyone has a definitive answer yet. But I know that your COVID page will be a good resource for pharmacists.
Okay, great. All right, let's take a question. We've got a clinical question here, and I'm going to call upon Dan Zlot to help me with this particular question as a part of our open forum. This is a part where we give you a minute for your thoughts. So anything at all relative to COVID that you'd like to ask questions about. But let's take this clinical question first. We actually have quite a number of clinical questions. There is a severe shortage that hospital pharmacists are telling us about relative to sedatives and other agents that are necessary for intubation and for the use of respirators. Can you speak, Dan, to what is happening with this and what the clinical options are and how this needs to be approached?
Thanks, Michael. And this is a very poignant and timely question. And I'm going to start off by saying we don't have all the answers. And this is an area that I think a lot of people are looking into right now, particularly those in the areas that have been hardest hit. And so, if you think about an intubated patient, there's really two components typically to maintaining a patient on intubation, and that's both sedation and then depending on the level of sedation and the particular patient, oftentimes the induction of paralysis through the use of paralytics. And so as both of those medications have gone on shortage, people are needing to get creative in order to maintain patients on ventilators. And so this is actually happening right now in some hospitals, unfortunately. And as I said, pharmacists are needing to get very creative with this. I've heard, just in thinking through how I would handle this for my patients in the ICU, I've thought about maybe seeing if my hospital could obtain the raw active pharmaceutical ingredients or APIs for some of these medications and doing what USP would consider to be quote unquote high risk compounding and then giving them the appropriately short dated beyond use dates for those medications so I could maintain a supply once the commercially available IV products ran out. And if we were truly out of all the options, I'd start digging through the history books and taking a look at what was used for sedation and anesthesia prior to some of the more modern things out there. In particular, barbiturates have been used in the past, things like that. And I'm just, thinking of these things, putting myself in a position where we truly have none of the typical things that we would usually use. And this is really worst case scenario kind of stuff. So those are some solutions that I would be thinking about. I'm sure that there are people out there who are smarter than I am and who do much more of this than I did, who are also faced with this and are coming up with great answers. So we will continue to focus on this. And as we get some more information and recommendations from people who are unfortunately going through this exact scenario on the front lines, we will be making that information available as we have some solutions to recommend, but would love to hear people's thoughts on this as well.
Dan, just a follow-up question to that. We did receive a question in advance prior to the start of the webinar about the strategic national stockpile and if there are any efforts ongoing relative to the strategic national stockpile and advocating for that for hospitals. Maybe Elisa, you should give us some responses, Director of Government Affairs. What's happening with the SNS as it relates to sedatives and neuromuscular blockers and so forth?
Yeah, thanks, Michael. Yeah, access to those backup drugs in the strategic national stockpile is essential. We are working with our sister pharmacy organizations that are working with the administration and others to ensure that appropriate, adequate, that there's appropriate, adequate, and fair distribution of the drugs from the stockpile. So that's all really that I can say right now.
Okay, great, good information. Let's open the line of Matthew LaCroix. Matthew's got a question about COVID testing as well.
Okay, line's open.
Sure, thank you. My state association's been asked to try to find whatever we can to help develop the policy around the executive orders that might be needed on the COVID testing. So really looking for any guidance on billing reimbursement and specifically how we can build in tracking of this stuff to state labs and state departments of health from the pharmacy end.
Okay, Elisa, would you like to take that question?
Yeah, thank you. Really good question, because the whole, as we sort through the payment issues, we need to be able to bill for it. APhA has already started working on guidance for billing, and as all these questions are answered about, the who, the what, the where, that it'll be provided in this billing guidance. So stay tuned. Again, that will be on our website. The tracking. Oh, you asked a question about tracking. Sorry, I just wrote tracking.
It's tracking for state reporting of positives or negatives or any of those type of things.
At least
I'm not familiar. Okay, go ahead. Thank you.
Mitch,
hi, Matt. Yes, Mitch. So, Matt, I am aware, because we've been involved in discussions of looking at utilization of immunization registries, potentially being a way of capturing some of those results so that there's a central database for states and then reporting those up to the federal government. That's one strategy that I've heard being looked at. No answers at this point whether that will work or not. And they're also getting ready when the vaccine is available of using that mechanism as well. So that's one mechanism they're looking at. I haven't heard any definitive answers in terms of tracking. And I think right now each state is using kind of their own developed program to try to track it.
All right, we're going to move to another clinical question. We get regular questions about hydroxychloroquine, and APhA did release a couple weeks ago a 15-minute CE webinar on the use of hydroxychloroquine in the treatment of COVID-19 and what we know about it. But we've got several people who are asking questions about where we are with hydroxychloroquine. Let me ask, let's see, Maria Teresa Ambrosini, if you could ask your question, and we'll ask Dan Zlot to give us a short and brief update on hydroxychloroquine and COVID. Technical issues here, Maria. I'm going to ask your question for you. An analysis of drug treatment for COVID-19 infections indicates that hydroxychloroquine treatment may be effective with a 90% survival rate to discharge. Another sister organization shared this information. Can you talk just a little bit more about whether new information is coming out, Dan, on the use of hydroxychloroquine and its efficacy?
Absolutely. So this is a great question, and I'll keep it relatively brief because this could be a whole talk in and of itself. So this was based on the original hydroxychloroquine data that was in 42 patients where they combined hydroxychloroquine with azithromycin, and they showed virologic clearance in 6 days in 6 patients, grand total of 6 patients who got that combination. They have now extended out that experience and now include up to a little over 80 patients. In that experience, for the first time, instead of just looking at virologic outcomes, in other words, whether you're able to clear the virus from your system, they also included some clinical outcomes in that study. And in that study, every patient who was included in the study, except for one, survived COVID-19, at least as of the time of the report. A couple were still in the ICU, if I remember correctly. And so if you do the math, that's like a 1.25% mortality rate. Couple issues with that trial. It's still not a controlled trial. So in that particular arm, there were no controls. So it's a case series, if you will. It's a very large case series, but it's a case series. So it looks like it's good evidence. It's difficult to know, though, without that control arm, whether it's really better than the general population or not. So that's the latest. There's constantly information coming out, however, so I wouldn't be surprised if the information tomorrow was different than the information I just shared.
Okay, great. We had a question that I don't see right now, but I saw it come across a little bit earlier, so I'm going to ask this question. How can a pharmacist be trained to do COVID testing, and how do we know that COVID tests that are being marketed are legitimate? Though these are topics that we've dealt with last week, I would encourage everybody to go back to last week's webinar. You can access it on pharmacists.com. We had a very good discussion about how to determine if a marketed test that you're getting advertisements for in your email and on your fax machines and in the mail are legitimate tests for COVID-19 or if it's a scam. And I would really encourage you to listen to that because we had great information shared by Elisa Bernstein, our staff member who was longtime FDA staffer. She shared wonderful insights on that. So please go back and listen to that. It will be very helpful to you, we think, on being able to make that discernment. But I would ask Dan Slott, could you tell us a little bit about what's to come as it relates to training for pharmacists on COVID-19 testing?
Absolutely. This is a great question. I think one there's obviously going to be great need for as we look forward to being able to actually conduct these tests. So APhA is in the process of developing training that will train you how to do specimen collection properly. And then you'll combine that with whatever device you're using. There are a number of them out there, and we anticipate that the number of tests will expand. So it's important to understand how to use the device as well. But typically, our training will consist of understanding PPE, what PPE is essential, how to use the PPE, how to put it on and take it off. Surprisingly, things like taking off PPE is one of the greatest sources of infection, at least in hospital workers. So understanding how to properly take off PPE, and then of course how to actually collect the specimen, handle the specimen, etc. And that's also somewhat dependent on what testing platform you're using. But those are the types of things that you can look forward to from our training. And as I said, that's in development. We'll be releasing that as quickly as we humanly can get that out the door.
All right, we're going to take one last oral question, and then we have a few more things that we want to share with you in terms of information. The last question I'm going to take live is from George Doe. George has a question about underutilization of willing providers, and we'll direct this to Carmen Catazone. George, we'll unmute your line.
His line's open.
Okay. Can you hear me fine?
Yes, we can hear you.
Okay, yeah, I saw a news article from New York Times that there are a lot of volunteers right now that have gone to New York and are waiting for assignments, but it seems like there's a mismatch at this time. Like my fiance, she's a pharmacist on Long Island, and she was asked to do overtime this week even. So what's the kind of like the solution to that, and for people that want to work but can't find assignments?
Yeah, New York is a unique situation, and we're working with the New York Board of Pharmacy and the New York State Department of Education. What they've said is that the executive order they issued for physicians and nurses doesn't apply to pharmacists, and that's why they're not being able to allow pharmacists who volunteer or other practitioners actually practice in New York and assist with the pandemic. But I know the state education department and the Board of Pharmacy are pushing aggressively to try and get the governor's office to extend that to pharmacists and to allow them to take advantage of people like yourself and your fiance who want to help in New York.
And related to that, Carmen, could you speak about retired pharmacists? So if we have pharmacists who are retired or who have allowed their license to go inactive, are states allowing those people to help in some way?
Yeah, many states have asked those practitioners to come back into practice to assist. And again, it's a state-by-state decision, but something unprecedented again, Michael, to bring those practitioners back and allow them to practice.
Yeah. Okay. Well, that's great. Well, let's move on to a couple of other things important information we want to share with you all. Just to reemphasize, remember these recordings, these webinars are recorded each week and are available on pharmacists.com. And I do want to point everybody specifically again to last week's webinar on COVID testing. You should also know that APhA is releasing every week new episodes of our series, APhA's 15 on COVID-19. This is an educational series that's really designed to help you sort through what is a huge volume of information hitting us constantly, and we want to make sure that you have the information that you need. These two episodes that you see on the screen were released this last week, and we have another episode that'll be released tomorrow on testing. And so we want to keep you in the loop on all of these things and provide you with the latest information that's happening with COVID-19. Now, we also want to give you just a little bit of information about advocacy that's going on. As you know, we already spoke today about the COVID-19 testing and HHS's guidance. I will assure you that APhA's advocacy team is working tirelessly, very long hours, working strongly with CMS and federal payers to also ensure that there's payment for this testing, because now that we have this authority to be able to do these tests, assuming that you have appropriate PPE, we want to make sure that that happens. You should also know that APhA reached out to a representative from Michigan and had pharmacists added to the HEROES Act of 2020, which gives first responders a 4-month tax holiday. This is important that this is moving through Congress. It hasn't been passed yet, but I want to personally give thanks to the APhA staff who helped make this happen so that pharmacists are included in the HEROES Act, and you all can advocate with your representatives in Congress to pass the HEROES Act of 2020, which will assist all of you as you go forward. And then, in addition, the APhA is working closely with our sister pharmacy organizations to address compounding issues with the FDA. As we know, we want to look carefully at all of these things, and you can see several things that are listed here where we're looking at there is clarification that hospitals and health systems are not going to be subject to the 1-mile radius provision. They do not intend to enforce the 5% limit on interstate distribution until an MOU is finalized. They also are looking carefully at the drugs on shortage list are not marketed for commercial availability under the essentially a copy provision, which the FDA has in the past said that pharmacists can't compound those drugs, but they're easing up on that. And then outsourcing facilities. As you can see, they're not going to take action on compounded drugs for that during this time of crisis. So those are some advocacy things that are going on. There's continued advocacy with the FDA, and we'll keep you posted on that through our news releases and through our website. On the next slide, please. Also, a number of new practice resources have been posted to pharmacists.com. And again, at the very top of pharmacists.com is a link to the COVID-19 resources. There's quite a number of things here. I'm most excited about this very top one, lessons from the front lines, advice from members and by members. I really want to encourage all of you who are practicing on the front lines to send us your stories. And I'm going to share with you in just a moment how you can do that. But certainly we want to hear your stories so that we can share those with others. We also have information about how to practice across state lines through NABP Passport and what you need to know about personal protective equipment. And of course, I mentioned the COVID-19 fraudulent medical products and scams. And then we're also working on the COVID testing. So while we've got Carmen Catazone on the line, just real quickly, any comment you would like to make about NABP Passport?
Michael, thank you. That program's available. A number of states, I think about 18 states, are opted in to use that program, and that'll help pharmacists trying to volunteer or practice remotely in the states. Again, most states are looking at the issue. Most states are working with pharmacists to do that remote practice. Passport is a tool to do that, but please check with your individual state to make sure they're allowing for pharmacists to practice or to practice within their states.
Okay, and Dan Slott, I'd like for you to just very quickly, in a minute or less, share with us a call to action that you'd like to make to pharmacists on the call today. Staff, next slide. Did we lose Dan? Well, we've lost Dan. So
Sorry, I was on mute. Sorry
Okay.
about that.
All right. Go ahead, Dan.
All right. So one of the things that I'm sure you've all seen is that there are a huge number of testing sites rolling out across the country. And a lot of the testing sites are needing folks who can help ensure that their volunteers are able to collect specimens correctly, perform the tests correctly, et cetera. So if you have any experience with this at all, we have a call for volunteers out right now, and we would love to get your information so that we can pass that along to groups who are looking to expand testing capabilities in local communities. So we've got a website set up there, a survey that you can participate in, and we've gotten great responses so far. We've gotten hundreds of responses, which I think just speaks highly of pharmacists' willingness to step up and volunteer and be there for our communities. So if that's of interest to you, please check out the survey, submit your availability and your skill set, and we'll be looking to pass that information along to those who need volunteers.
Okay. And as I mentioned to you, we want to hear your stories. How can you do that? Well, APhA has a platform called Engage, and we have a discussion group that set up, the Pharmacy Response to COVID-19, where you can post questions, share your lessons learned, support your colleagues, and access the latest information. We would urge you to take advantage of this and share your stories. We want to hear from you. APhA is here to represent all of pharmacy and to do everything we can to advocate on your behalf day in and day out. So join us next week at same day, same time, same place here at your computer. We'll do our weekly webinar on Thursday, April the 16th from 1 to 2. Today's webinar recording and slides will be available within 24 hours, and tomorrow we will post the registration link so that you can register for next week's webinar. I want to take this last moment to thank our guest today, Carmen Catazone from NABP. Carmen, thanks for sharing your wisdom with us about state boards of pharmacy, and thanks to all of you for your tireless efforts in responding to the COVID-19 crisis. Be well.